You think you're ready for the adjustment? He's focusing. And it just went like that. Hey, welcome back, man. Good to see you.
Good to see you.
And we're working with, you said the low back today, right?
Middle, low back, yes.
And you said also you felt like it could be compensating for your
Right shoulder.
right shoulder. So Jay's already doing some PT, but he goes, and that's great. But he feels like having the shoulder is throwing off issues in his back. But you could see his arm rotates in more easily here on this right side versus this left side. So PT will be really working on building the rotator cuff up and doing a good job there. But shoulder blade is still coming up high, and this muscle here on the side, go ahead, Jay, and present your side here. This muscle called the latissimus dorsi that actually inserts in the front of his arm, front of his shoulder here, and wraps around and actually goes into his lower back here, is under some stress. A lot of times when we do a rehab exercise or work with other folks, what will happen is people are so engaged in working their shoulder or an issue, sometimes they forget to brace enough here. So as I'm working my shoulder really hard here and moving here, sometimes the core will buckle and stress in an effort to move stress off of this area. So I'll maybe do things like this to get the shoulder up higher. Yeah, you can relate. Or when I'm moving here. So we're gonna learn abdominal core bracing. And what I want you to think about is, think about the core being like a cylinder. So this would be your pelvic floor here. This would be your diaphragm up here.
Okay.
And you can see just by taking this roll of paper and cylindering it, if I keep everything in balance, that's pretty solid.
Yes.
But what's happening with you is that because this muscle is so tight, it's actually causing some distortion in your frame right here. Okay. So now that there's distortion right there, now that I bent it, now when I apply it it just crumbles just like that. So by learning how to abdominally brace and putting the bones back in place, we keep your back from collapsing. Now, what will your body do to keep you from collapsing is it will splint and spasm. So you can see if I pinch the paper here, now it doesn't collapse. That pinch in the body represents a muscle spasm. Take your knees like this, you're in the hook lying position here, and you're gonna go ahead and push your feet down against the table. As you push your feet down against the table, you're gonna also, but you're gonna attempt to just activate your hamstrings. A good way to do that is activate your muscles as if to draw your heels towards your glutes, but don't actually do so.
Okay.
Good, and they're on line. So you got a great core right now. Now what you're gonna do is you're gonna pin your ribs to the table. So you're just gonna push down. Don't tighten this yet. Just push down from the back. There. So he's holding tension in his back and he's holding tension in his abs at the same time. Go ahead and do that. Hold there. Now try to just breathe doing this. Good. Try to get breath into here. And if he's doing it right, yeah, look guys, look, his belly's moving and he's actually doing it, and his sides are actually starting to come out too. So he's getting that breathing down, and look, the chest is hardly moving. By the way, Jay also, can I tell everybody, is a ninja. So obviously he's good at doing this. But now when he does this, now you want to make sure you keep the trunk engaged when you're doing your shoulder exercises.
Okay.
So do that first. Sometimes when we're rehabbing an area, the rest of the body distorts. So sometimes we got to go back and just review that. If he wants to solidify this concept, he can do an exercise called ball bugs. Oh, and if you want more information on this exercise, this core bracing thing, my son Roman and I just did a video on just bracing. And we'll be releasing that in the next couple of days. So look for that, Todd Johnsonbaugh, core bracing, if you want more information about how to brace that core. And now you're going to take your hands like this, up here. Now the feet are going to come up here, Jay. Good job. Both feet up here. Good. Now go ahead, and draw down. Now, how's that feel on your back, okay?
Okay.
Now, your back, won't let your back flatten totally. Don't let it arch too much.
Okay.
Now, you should feel like that engages all of those muscles. Now, what he's going to do is, as you keep this, now slowly move this arm off and lift it up here while you keep that. Now, you're learning to hold that core, and now you're getting that concept, or you can bring the arm out here. So now you're learning how to hold the core and start to do arm movement. Now try the other arm just to balance it out. Good. And you can bring it overhead if you're up to it, if you whatever you want to do. Now he could bring a leg. Now try a leg down. Now this is hard. Keep that core. Ninja. Ninja. Good job. Jay is a great model for this. Most people don't take this. And if we wanted to get fancy, we could alternate arm and leg at the same time. Okay, Mike, we truly have a ninja here. He's doing a great job. Oh my gosh. Welcome back. So you're warmed up and ready for the adjustment. Let's go right into the adjustment room. And Jay, I feel immediately when I'm pushing here at where lumbar number 5 meets the sacrum, where are you noticing, man? And also I'm feeling like right in here at lumbar vertebrae number 3 and 4, right there especially. You know how the whole spine wants to flatten? Sometimes like it wants to go like this too much.
Right.
You're gonna wanna make sure you keep that neutral. So that's the combination of drawing your shoulder blades down. Show us drawing the shoulder blades down again, putting them in your back pocket. Good. And give me the abdominal bracing. Great. Let's do that together while I immobilize. So rest. Now go ahead and do that bracing again. Good. And relax. And now we're doing this together, guys. And when we do the bracing with manual therapy, this is a form of kinetic manual therapy. It's a way for Jay to get reinforced how to do his work and also feel how that muscle contractions starts to draw stress off of the spine, off of the joints. Go ahead and give me that bracing again. But it really helps solidify those principles when you combine exercise with the manual therapy. Great. And now let's get in here. Oh, this is going to be a good one. So now, Jay, we got you side lying. Go ahead and sideline and give me those tight muscles. Good. He's got the abs braced. And then relax. And do that again, Jay. Beautiful. And go again. Nice. Now what we're going to do is, you think you're ready for the adjustment? He's been doing all his work. He's focusing. And it just went like that. You see how easy it was when we've worked done before, but we've never done like, that was cool.
Yeah, it was.
That was really good because, I mean, by the time we actually get to this, it was such an effortless event. Mike, did I have my fingertips on that vertebrae? I think so. I think my fingertips were there. So it was just a fingertip adjustment. That was awesome. Now we're going to go down here, and we're going to get this guy too. Oh, just a little bit right there. Relax right up there. Good cueing. Nope, it's not letting me in yet. Relax right there. Because I've told Jay this before, I feel like I get more out of his presence than probably he receives from my treatment. And we'll go back and forth and argue with each other on that. But he's such a calming person and epitomizes how breath and body can be used that I really wanted you all to see this, and it just worked out really well. So a lot of folks think that chiropractic can't harmonize with physical therapy, or they have to be used interdependently of each other. But today we really demonstrated how sometimes you need both to help really facilitate healing. Or we can collaborate with physical therapists, sometimes acupuncturists, massage therapists, orthopedists. We sometimes work with your primary care.
Yes.
The sky's the limit. It's really fun.